People is proud to present the 40 Days 40 FinTechs, an initiative under its Include Everyone program, which is leading the way in advocating for technology that promotes financial inclusivity. Since 2020, we've profiled over 100 FinTechs, and our latest season is shining a spotlight on those breaking down digital barriers and transforming lives for the better. Join us in this financial inclusivity revolution, presented with generous support from the Bill and Melinda Gates Foundation. Follow hashtag 40 Days 40 FinTechs, hashtag Level 1 Project to learn more and get involved in creating a brighter financial future for all.
The 40 Days for FinTechs initiative continues to shine a spotlight on innovators that are using financial technology to serve the unserved and underserved people in Uganda and across Africa. On day 18 of the annual 40 Days for FinTechs initiative, Season 5, we are happy to host someone from Venro Healthcare. How are you, sir?
I'm good, sir.
Yes, thank you for coming today. Kindly introduce yourself.
My name is Ssonko Kenneth. I'm a pharmacy technician by profession, a co-founder of Venro Healthcare, as well a client license manager, Venro Healthcare.
Yeah, for those maybe that don't know, what is the short form for a pharmacy technician?
Pharmacy technician?
Yes.
FarmTech.
FarmTech.
Dispenser.
FarmTech to mean farm and nimiro?
No,
Pharmacy.
As in pharmacy, P-H-A-A-R.
Oh, I get you. So you're a FarmTech.
Yes.
That is the fancy word you use.
Exactly.
To confuse people.
You've said it well.
Thank you, Kenneth. It's a pleasure having you today. So for those watching you for the very first time, please tell us what is Venro, what do you do, and how did you start doing what you do?
Venro Healthcare is a telemedicine company. It offers physical home-based care. So our main aim is to make healthcare accessible to everyone, accessible and affordable. Yes. So we offer doctor home visits whereby you don't need to trek distances to access medical care. So we have an online platform, or what we call a website. One can schedule an appointment requesting for a doctor or a specialist that is regarding on their clinical presentation. So a doctor moves to them at the convenience of their homes or at office. They can do the assessment from there. If there is need to do or run tests, they can collect samples, and they have the samples brought back to our facility, run the test, then revert with the results. So they don't need to move, so you can send these results via email or WhatsApp. Yeah. The other service is bedside nursing or nursing care. So as we go on, we usually have limited time to take care of our beloved ones, especially when they are sick. Be it, for example, if maybe your wife has delivered, you don't have someone to take care of her. So we have a trained team of nurses. These ones, they are specialized to take care of people with their different care needs. So you can offer this kind of care at the comfort of their home or in the hospital. Then the other service is online medicine delivery. So we have an online e-commerce platform. So it is an electronic pharmacy, I would call it like that way. Yes. So you can order medicines from the comfort of your bed, your office, even on the roadside. So for those controlled medicines, you are required to present a prescription. So you can order your medicines from our platform. You do the payments online, either be it a merchant code, online banking. So when that is done, so we have to contact you on regarding the delivery details. So deliver the items to you without any hassle.
Yes, sir.
So hassle-free. So the other stuff is consultancy. Yeah.
Yes, I wanted to first understand before we go into the details of how you do transaction and how it is completed. When did you start doing this, and what market problem do you seek to solve?
We started this kind of service in late 2020. Late 2020, that is when we had the second strike of COVID. Yes. So realized people were facing it hard to access medical care because movements were limited, but healthcare workers were allowed to move. So we started it on a small scale. And the reason one of the challenges we are facing is that people are coping up with this kind of healthcare delivery system at a slow pace. So they think it is not feasible. So one of the challenges we have is a market challenge. So we've not penetrated that much to the community.
So yes, as a COVID baby, if I would say that, because you were born in the middle of COVID, how many customers have you so far served?
Well, I could say we are coming to 1,000 clients. And as we speak right now, we have a physical facility, because as we started, we didn't have physical facility to utilize. We're utilizing with a facility of one of our comrades, our partners. But as we speak right now, we have a physical facility. So we are coming to almost 1,000 clients. For the physical facility, I think they should be even exceeding 50.
Now, Kenneth, take me through a customer journey. How do I log onto the platform? How do I get in touch with the doctor, maybe for consultancy? How do I do the payments? At what point do I do the payments? And at what point does the entire transaction get completed? In that case, to mean, at what time do we confirm that I've actually got the service I paid for?
Well, what happens? So we have a website. So one has to visit it. So we have as well an app on App Store. So you can either download the app or visit the website www.venrohealthcare.com. So there is a portal where you can create an account. So there is a procedure for you to follow. After creating the account, you can select which kind of service you need. So there is specialty services, there's general doctor, there's nursing care. So basically,
Pharmacy services?
Yeah, pharmacy services. So on that same website, there is a part where there is online pharmacy. So if you just need medicine, just tap there. So then if you need a doctor visit at home, so if you require a general doctor, you select general doctor, and the system will bring for you a list of doctors. So you choose your preferable doctor to visit you at home. So what happens when you have scheduled an appointment? Let's say you schedule for tomorrow morning. Let me say around 8. So our system will notify us that Kasule Michael has scheduled an appointment to have a general doctor.
Nicholas Kalunji.
Yes, to attend to him or her at a convenience maybe of her home, maybe in Gayaza at this particular time. So we'll notify that doctor. Actually, even that doctor gets notification that patient so and so in Gayaza has scheduled an appointment to have you visit her or maybe assess her. So what we do, we follow up with this client. We call, we do an assessment that is regarding the care needs. So we have to know what that patient really needs before we reach out to their home. So the doctor moves to them, does the assessment. If there's need to collect a sample, we collect it. If they need a service like maybe dental, they need maybe a tooth extraction, teeth filling, or teeth cleaning. So at times we move them to our facility and do the service from there. So after the service or during the middle of the service, we tell that your bill will be like this. So these are the payment options. Yeah. So after the service, that's when they pay. At times they pay in bits.
How do they pay?
So they can either pay via mobile money or through merchant code or bank deposit or online banking. Yes.
Now, Kenneth, I want to understand. I have understood your model. And I want to ask a question that maybe benefits you more than the end users. You have said the customer pays at a point after they have received the services. What if a customer refuses to pay?
Usually, before we commence with the service, we share with them how we charge. For example, for the home doctor's visit, we shall tell them if you need us, we'll charge you 50K for the doctor's visit. If that is minus tests and maybe the medicines. So before we really move to their homes, they have to know that they have to cater for the doctor's review whatever fees and the transport costs and maybe the fees for the test.
I mean, I get that bit. That's why I've asked. What if a patient by the names of George refuses to pay?
Usually, they have to sign consent forms. So before we go on to give the service, you have to consent that you have to pay.
Because you see, Kenneth, in a traditional hospital, for instance, they don't do consultation before you pay. Isn't it? Now here we are in a telemedicine environment where it involves even the doctor driving or taking a taxi border to Gayaza at his cost. So what are you doing to ensure that your doctors are protected from things like, for example, not being paid? Because it can actually happen.
Well, we have not faced that so far.
Yes.
Good enough, most of the referrals that we are getting, they are the people that we know. So, for example, if we work on George today, George will refer us to the friend, to Nicholas. So there's that trust. So Nicholas will find it hard to not to pay for the service because it is a friend that has recommended. But we've had a scenario where some failed to pay, and we really faced hardships collecting that money. But at the end of the day, we get it, but after a long struggle. Yeah, but they have to consent before offer the service.
I get it. And I think that is something you need to look at and improve as you go along. Be that as it may, let us assume I'm a patient. I've asked for service, but my service includes some tests, some imaging. How do you manage that?
Well, at the convenience of your home, at your office, may not be able to bring the machine at your place, at your office. So what we do, we transport you to our facility, and for those services that we don't offer, there are some big hospitals that we partner with. So make sure that we have you in our hands, and you are able to access every kind of healthcare needs that you require.
So am I right to say we're 360 fully fledged
Exactly.
healthcare service provider? More than 360.
So long as you contact us, yes, your medical needs are covered.
All right. Great to hear. Yes, for the 2-3 years you have been working, what are the main challenges you have faced in rolling out such an amazing service?
Well, firstly, that is delaying payments, especially for the nursing care. You find that you've worked on a particular client, offered nursing care, you've assigned 2 nurses on a particular patient, and for 2 weeks or even for a month, and they take about 3 months or 2 months without paying, but eventually they pay. So that's, at times, don't mind so much about that.
So you were patient business, because most hospitals are not patient.
Indeed.
Yet they serve patients, but they are not patient.
So what we mind about is the patient-centered management. So we mind about you recovering from your illness, as well. Make sure that you have to pay at least in time, because we also need to clear out, to pay salaries for staffs.
Yes. What other challenge?
So another challenge is marketing, and that is reaching out to the communities. Find that a few individuals or the community doesn't know more about this kind of service. They think it is not possible. They think it is not secure at all.
It's a new thing.
Yeah. So marketing. The other thing is equipments, like let me say, since we are dealing with technology, I find that internet is a challenge. It is on and off. It is expensive.
Yes, now I want to speak more about how you have married the healthcare with financial technology. Because you have told me you have payments, mobile money, bank cards, among others. So who receives this money? Is it you or the doctors? For example, if Dr. Nicholas Kalungi is the one attending to the patient, is the money paid directly to Dr. Nicholas Kalungi, or it is paid to Venro, and later Venro does a reconciliation and remits what is my share of that money?
What happens is that initially, before we had these systemized payment modes, usually clients could pay cash to the service provider, that is the doctors. And we had a scenario when a client paid, instead of paying 150, he gave the doctor 100, and he claimed that he had given the doctor 150, yet in actual sense, he gave the doctor 100.
We are not sure.
Yeah, so we are not sure where the money got lost from. So what we did, we had to streamline that. So when we issue an invoice, it has payment details. So you can either pay via MTN merchant code, Airtel merchant code, direct to mobile money. You can do a bank transfer.
Exactly.
Yes.
Okay. Your service providers,
they don't receive
do a
money.
cashless process. They don't receive anything.
And what happens? They receive commission on a particular service that they offer to the client.
Okay.
Yes.
Good to know, Kenneth. Yes, as a debutant on 4 Days for the FinTech initiative, we are very happy to have you. Please make me understand. How do you think a platform like 4 Days for the FinTech will help further your cause as Venro Healthcare?
It can help us reach out to spread this slogan or this kind of healthcare delivery to the community. So it can help us reach a larger group of people to understand this kind of service delivery to them, and as well help us maybe for financial money we are not so badly off. Yeah, So maybe, if possible, if there is need, maybe to help us have partners where they can help us reach out to the community and spread this kind of service to the community.
All right, Kenneth, it has been a pleasure having you. In 2 minutes and in your camera, please do your closing remarks and give a brief pitch as to why people should use your service vis-a-vis other services on the market.
To our viewers and our customers, our dear esteemed customers and clients, we've served for almost close to 3 years. Would wish to advocate you to utilize this kind of service delivery. This is because it saves you from the movements to the hospital. For example, you might have your granny, your mom, so you may not need to move these patients, especially if their conditions, they are not chronic. So you just simply need to call us. We shall offer this service at the comfort of your home. Don't give them headache or hard time to move to the hospitals, waiting long queues. They can have healthcare moved to them at the comfort of their homes. Venro Healthcare offers care for the elderly, care for the needy, and for clients that don't have attendants. So you don't need to, the other services, you don't need to move to the pharmacies or drug shops to receive medicines or order medicines. Simply visit our website, that is Venro Online Pharmacy, with your prescription handy. Look for the item that you need from the search bar. For example, if you need NAN1, that is for the baby's milk, search it, follow the procedures, your medicine or your item will be delivered to you at the comfort of your home. So we're just a call away. Feel free to contact us. Our services are really affordable and trusted.
Yeah, thank you very much. Like you have heard from Kenneth, Venro Healthcare has married healthcare and fintech, and in so doing, it is offering affordable and convenient healthcare services. This has been day 18 of the annual 40 Days for the Fintechs Initiative, Season 5. Thank you so much for watching and see you soon.